Okay. All right. Thank you. I'm not able to take this off, but that's okay. So when it comes on to triaging, there are 4 codes that you need to know and must know for the NCLEX. It's called the triaging color code system. And this helps the nurse to see when they talk about triaging is organizing or setting who do I see first, who do I see last, and so forth and so on. Depending on where you are, is going to be determined who you see first. And this is very important. A black color indicates that this person is not likely to survive given their current information, given what's going on with them, is there that they're not likely to survive. Now, if you're in the hospital setting and the emergency room, this person becomes your priority in the emergency room. But if you're out in like a natural disaster area where there is no resource and so forth, this person is not going to be your primary person that you'll be looking at. What manifestation this person will show? They're not breathing. Even if after airway positioning, putting up in semi-fall, they're not breathing. They're unsurvivable, meaning that the injury that they get, they will not survive. Like massive head injury. Some part of their body is decapitated. If possible, comfort care. But in a natural disaster, those people or those clients you will not see. Do not use extensive resources on them in a natural disaster because they will not survive. The second is the red. This client, life-threatening but survivable, meaning that whatever they're going through is life-threatening, but with some intervention, they may be saved. All right? Like for example, now if someone who is bleeding severely, so if this person is bleeding severely, you can get a belt, tie around to create like a restriction to reduce the bleeding that can occur. So they will be treated first, especially with resources, if the resources are available. The goal is to save the most life with the most available care. So that's why with especially outside in a natural disaster where you don't have enough resources already, you wouldn't waste time on a client who's in the black category. Now, if you're in the emergency room, you'd see them, yes, right? Now, the yellow, they're serious, but they're not immediately life-threatening. They can wait 30 minutes to 2 hours. They have stable airway. The bleeding is controlled, or maybe they have a fracture. Treatment delay until the red case are stabilized. So you will delay treatment for the one in yellow until these individuals in the red are stabilized. Okay. And in the yellow, you will monitor for any kind of deterioration. But again, these you're talking about people who have bleeding that are controlled, fracture, all right, and they have a stable airway. In the green, these individuals, we call them walking wounded. Minor cuts, abrasion, they may have a sprain, they may help with less critical role, but they're the lowest priority in terms, well, black is the lowest priority, but these individuals, you would not see them first. You would see them last. You will see the red, the yellow, then the green. Okay? So those are the color coding as it relates to the system of triaging. I want to add a couple of things to this. I have to say that yesterday, going to church, I was a little bit nervous, and I had decided that when they're praying, we have a couple of police officers in our church, and I made the call because of what's going on now, and with the rumors of war, and it doesn't have to be war, it could be any other blowing up of any kind of radiation substances. Remember this, whenever there's an explosion for radiation, right? If you're taking off somebody close, someone who's exposed to radiation, and they come into the emergency room, how would you remove their clothes? Anyone?
You cut it off?
You cut it off.
Cut it.
Yes. Yeah, you cut it off. Why would you cut it off? Why? Kim, why?
Because I think it will be it's more easily accessible than to be taking it off, I mean, over the head or whatever. You cut it off to get easy access to the body parts to see what's happening.
Well, yes, but here's what happened. Because remember now, these people were exposed to radiation. They don't, it's not necessarily wounded, they're wounded, but the radiation on the clothes, when you take it off,
You don't want to
remember,
put on the body.
you don't want to inhale it. You don't want to inhale it, because on the outside, the radiation is going to be on the outside. And when you're taking off the clothes, it's the outside of the clothes that's going over the face. So one of the most important part is inhale that. So remember that when it comes on to any kind of explosion or radiation, all right? So a building collapse, 20 victims, limited resources. There are 3 blacks, 5 red, 7 yellow, and 5 greens. You want to make sure that you focus resources on the 5 red patients first. All right. Green victim helps with minor tasks. The green victim, because remember, they're not that seriously injured, so they can even help with minor tasks depending on what it is. Because remember, the building collapsed in this scenario. Yellow patient can be monitored while they're waiting for care, but the focus goes around the red victims, all right, or victims that are labeled as red. And so remember that individuals who are red, they have a life-threatening issue. That could be a severe, especially severe bleeding. And an intervention can be done right there and then to save their lives. All right? Any question about that?
But when I was doing questions, I saw a question on gray tag.
Okay, let me ask you something. So based on what you sent me, you talk about triaging.
Yes.
Okay, what was the question?
Oh, I should go to open it. Let me go
No,
to.
that's fine. If you don't have it, that's fine. Here's the thing.
Let me see.
When it comes down to gray, if it is triaging, sometimes grays are used in a triaging system, but the gray tag is used when there is some advanced or specialized system. And this could be like in palliative care. It may indicate like a person who have a survival condition but need comfort care. And when it comes on to triaging and who to see first, I would definitely like to see that question. Very rare is unless you're talking about palliative care, limited resources, or are you talking about like code blue and code gray? Is it triaging? Or is it code blue or code gray?
What is the difference between code blue and
Okay.
code gray and color tag, please?
Okay. So in the triaging color tag, it helps the nurse to see who am I going to see first. It's a form of assessment. Okay, am I going to see you first? Am I going to see someone second? But as it relates to code, I don't know if you've ever been in the hospital yet where they say code blue, code blue. Now, code blue, this is a medical emergency, either a cardiac or a respiratory arrest where they have a team, and a team will run to the area that they announce code blue. All right. So that's code. That has to do with a hospital-wide system. So different code mean different things. Code blue, the medical emergency, cardiac arrest. Code red, not triage red, code red, fire or smoke. Code black is a bomb threat. Code pink is an infant or child abduction. Code purple, and I'm going to say this, sometimes a facility will use purple instead of pink. So pink and purple they will use for infant or child abduction. Code gray is a person who is combative or there's a security incident. Code silver meaning that there's an active shooter. Code white mean that there's a violent person. Code orange seem that there's a hazardous spill somewhere. Code green mean that they need to evacuate because there's a mass casualty somewhere going on. Code yellow meaning that there's a disaster or an external emergency, like there a building collapse, or there's a flood, or you have a group of people who would be rushing the triage. Code brown indicate that there is a bad weather. The code amber mean that there's a missing child. All right, and code clear is that all is clear. So when you say triage system, and the color is different from the code color. The triaging colors are for the nurse to decide who he or she is going to see first. The code color is a hospital system to alert everybody in the hospital. Code red on 2 North, code red on 2 North. There's a fire on 2 North. Code black, a bomb threat. Code pink, or purple, a child has been abducted. So look at that question again, Miss Rose, and let me know, okay?
Okay, the question said, during a busy shift in the emergency department, a code gray is announced over the hospital intercom. What is the nurse priority action?
Okay, and
A,
what is a code? What is a code gray?
oh,
Anyone? And I know I just list them out.
You just said
Combative, is that combative?
A combative person, yes. Yes.
yes, they say indicating a violent or aggressive individual. Is
Okay.
okay.
okay. I have a question. So in the hospital, code gray mean palliative individual. Also said that it could be palliative care for code gray.
No, if you're no, not for code gray, because she had sent me the question, say triaging. Gray is not normal in triaging, but in some hospitals, very rare you see them use triaging as gray. That would be palliative care.
Okay, because I know when they say code, that's mean triage. That's why I say on triage department.
No. So code is different from triaging, okay?
Okay.
Code is different from triaging. Triaging is what the nurse used to do his or her assessment of who he or she's going to see first. And a code is a hospital-wide announcement. Okay? And
Okay.
as it relates to what is the nurse's priority action for a code gray, safety is number one. Prioritize safety. And just on the plane, safety for the nurse and safety for others. All right. Move other patients and staff out of the way. Never try to physically intervene when it comes on to, unless the nurse has what we call a CPI training, which is a crisis prevention situation training. And then the nurse, after making sure everyone is safe, activate, call the appropriate number or code. All right, clearly communicate where the code is, what room it is. All right. And if the nurse must communicate with that patient, he or she should use a calm, non-threatening tone, maintain a safe distance, at least it's an arm length away from the patient. Do not argue and use short, clear sentences. Okay. If the question, if all the answer choices in the question is about you talking to the patient, it must be calm and non-threatening, must always have your eye on the door. There must always be a route of escape. All right.
Okay.